Good morning, everyone, and thank you for joining us here today. I am joined by Tammy Anderson, Development Officer for Alberta Prairies for the Juvenile Diabetes Research Foundation and a mother of a daughter with type 1 diabetes. Earlier this year, Alberta's government announced a change to the way in which insulin pump benefits are provided to Albertans living with diabetes. After the announcement, we heard from many Albertans who use these insulin pumps, diabetes organizations, and others who are concerned about this change. I recognize we did not approach this in the best way possible, and I have subsequently stopped this change. I also made a commitment to consult with Albertans who use insulin pumps to hear their concerns and to determine how best to move forward. Since that time, a telephone town hall with insulin pump users was held, and meetings with a number of diabetes stakeholders have taken place. And I've heard your message loud and clear. That is why I've decided to cancel the proposed shift of the changes in the insulin pump therapy program to government-sponsored benefits. To be clear, there will be no changes to the current program. In fact, we are adding to the list of covered products. Starting as soon as possible this year, Albertans who get insulin pumps and supplies through the program will have access to a number of newer pump models. In addition, coverage for continuous glucose monitors will continue to be provided to children and youth through government-sponsored health benefit plans. This is part of our commitment to providing access to newer life-saving technologies for Albertans living with diabetes. More information about the new pumps can be found online at alberta.ca. I'm also here today to tell you about next steps in our consultation process. I am putting together a diabetes working group to review how our healthcare system addresses the needs of Albertans living with this chronic disease. The working group will review the province's entire diabetes care pathway, including the roles of primary care physicians and other clinicians in the diagnosis and treatment of patients living with type 1 and type 2 diabetes. Their work will identify the current gaps in the system and identify any ways our current system can be improved. The working group will include representation from patients and their caregivers, diabetes organizations, health professionals, researchers, and others. And I'll be able to speak more details on this at a later time. Now, given the growing population of Albertans diagnosed with diabetes, a long-term pathway needs to be determined so Albertans can manage their diabetes and lower the risk of adverse outcomes and reduce the demands on our healthcare system. The cost per diabetic Albertan and the total cost of diabetes has increased over the last few years, and we need to continue to look at ways to manage that growth while we continue to provide access to new evidence-based therapies and supports. To be clear, the goal of the working group is not to find ways to save money. It is about providing better care, improving better health outcomes, and ensuring a sustainable system for the long term. Government costs on diabetes medications, supplies, and insulin pumps has increased by about 15% annually and nearly doubled over the last 5 years to $200 million. And we expect it to double again in the next 5 years to $381 million if our current system of care is not addressed. Diabetes is the fastest growing chronic disease in the province, and the best way to manage the cost and ensure that we have better health outcomes is through better treatment, especially early diagnosis and treatment, which reduces severe outcomes and hospitalizations. I'm asking the group to provide recommendations to me by the fall of 2023, and we'll have more details in terms of establishing that group early this September. As we manage diabetes care and supports going forward, we need to hear more from people who are living with diabetes and those who care for them. This next step will help us make better decisions, and so I look forward to hearing from the working groups about their findings and their recommendations next year. I would now like to invite Tammy Anderson from the JDRF to the podium. Thank you. Tammy?
Good morning. My name is Tammy Anderson. I'm here today representing JDRF Canada, the leading organization in funding research for type 1 diabetes. I am also mom to a daughter who has lived with type 1 for over 15 years. We are pleased that the Government of Alberta has affirmed its commitment to reinstate the insulin pump therapy program indefinitely. We are also pleased that the government is taking these steps to establish a diabetes working group, which JDRF will be a part of, to develop a comprehensive diabetes strategy for the province. Type 1 diabetes is a relentless 24 hours a day, 7 days a week disease, requiring constant monitoring and attention. From the moment of diagnosis, a person with type 1 diabetes is reliant on insulin to stay alive. Unfortunately, due to advancements in technology, they can manage this disease with the help of devices such as insulin pumps and advanced glucose monitoring systems. The Centers for Disease Control and Prevention estimate that people with type 1 diabetes are making roughly 300 or more decisions per day than with someone without type 1. They need to decide, do I need to eat or not? Do I need to eat less or more? Do I need to take insulin, and how much? Do I need to check my blood sugar? Even with vigilant management, the risk of long-term complications like heart and kidney disease and short-term realities of dangerously low blood sugar can lead to confusion, coma, and even death. Type 1 diabetes is also a costly disease, not only for our healthcare system, but for individuals and the families. Depending on your level of coverage, an individual with type 1 diabetes may be out of pocket for as much as $15,000 annually. This is why we are very supportive of the government's decision to continue and protect the insulin pump therapy program. Thousands of Albertans are very grateful for this continued investment, and JDRF Canada looks forward to working with the government to develop a comprehensive diabetes strategy for the province that allows people to live healthier, easier, and safer lives. Thank you.
Thank you, Tammy. We'll move on to the question portion of our program.
Okay.
We'll take questions from the mic first. Just state your name and outlet, and one question will follow up.
Perfect. It's Shalane Skalski with CTV News Edmonton. A question for the minister. I know you touched on it a little bit already, but just in terms of costs, I know when we talked earlier this year when the program was canceled, you estimated it would save a ballpark of about $10 billion. I'm just looking, how much do you think reinstating the program for the year will cost, and how much long-term are you anticipating keeping this program as it stands will cost the province?
Yeah, so we're looking at, this is one of the reasons why we're taking a step back in terms of looking at all the supports that we provide and looking at this from not only the cost of a particular program in terms of the supports, but the cost avoidance associated with the programs, like taking a broader lens, because we also know that diabetes is correlated to a number of other items, such whether it be heart disease, amputations, which actually drives costs in the system. So the extent that we can actually, perhaps invest more and save our costs longer term. And so not just narrowing down on this one small piece, which is the insulin pump. In regards to the actual numbers, we are continuing to have conversations with the pump providers and looking to be able to leverage our scale, to be able to reduce our costs. In an ideal world, as new technology comes on, it should not only be better, but ideally less expensive. So we have done some negotiations, and we may actually, and we'll get you the details on that. But my understanding is some of the negotiations that we've had on the newer pumps, we've actually been able to get some cost decreases. So we actually may be able to save money that way. But that's why it was important, because we heard from a number of people who are living with diabetes and suggesting that if we did some of the changes that we were considering, those middle income may have hard time actually paying for the pumps, and if they didn't have the pumps, that actually would increase our costs over the long term. So that's why we're taking a step back, setting up this group to look at not only how do we provide better services and better supports, but look at the entire cost structure on this. So we anticipate, and we don't have the details on hand, but we can get that to you later, that the cost of this particular program, if people go to the new pumps, and we've actually got a cost decrease, we're actually going to make some savings there. But it's less about that. That was too narrow a view. We need to take a broader view in terms of how do we keep people, quite frankly, healthier and out of the hospitals, because there's a cost savings there by investing and ensuring that we have early treatment and we have the supports available for those with diabetes.
Yeah, and just to follow up in terms of the issue of consultation, I heard from some patients and advocates who said they described the consultation up until this point as one poorly advertised town hall that even advocates very engaged in the community didn't really know about. So what guarantees are you giving to that community that they will have their voice heard as you start this working group up in the fall?
So a couple of things. First, it's going to be a broad-based working group, right? So, very pleased that JDRF will be participating. Invites will be going out over the course of August to other groups. It's going to include patients, it's going to include doctors, and then time. We're going to be spending a year having these consultations to looking at this, and my commitment that I appreciate that we didn't do a good enough job in consultation. We up front, people were surprised, and I apologize for that. So that's why we're actually taking a step back, looking at the entire, all the clinical pathways, looking at how do we provide better outcomes from a health standpoint, but also by looking at all the costs associated with it and reducing the need for people to come into the system. That's the proper approach. And by taking a step back and doing it in a holistic way with all of the partners at the table, then we'll be able to hear far more voices with more time. And again, we'll make an announcement in September in terms of all the people who are going to be participating as we finalize that list.
Thank you very much. Seeing as we have some callers on the line, operator, can you put through the first caller?
Michelle Bellefontaine, CBC.
Oh, hi there, Minister. I wonder if you can tell us a little bit more about the increased benefits and when people who are part of the insulin pump program can access them.
Yeah, so we're going to be able to, the details will go online about that, but we are going to be making available the new pumps as part of this program. We've just concluded the negotiations with the suppliers, and they should be accessible that's one of the reasons why we wanted to make this announcement right now. They should be accessible, commencing in early September, and people can actually find out more on the website and be able to look at how the program can operate throughout the month of August.
Thanks, Michelle. Do you have a follow-up?
Yeah, and I'm wondering, Minister, what was the tipping point for you in deciding to restore the program?
Yeah. Well, we never took the program away. What we simply were doing is because the intent of the announcement that we made earlier was simply to actually shift the program to a insurance-based program as opposed to a direct funded program. The tipping point for me was that the unintended consequences and quite frankly the narrow view that we had taken, because the approach, the desire to ensure that we have care for Albertans and ensure that's sustainable from a financial standpoint, that remains. But by looking only at this one narrow program as opposed to the whole pathway, and not taking into consideration not just the cost of providing supports, but the savings associated with by providing the supports, we keep people out of hospital. We didn't look at it from that point of view, and so really it's not only the input that we got from the town hall, but I had opportunity to speak with a number of stakeholders since I made that announcement, since the town hall, and a number of constituents and other Albertans who actually relied on the program, what the impact it would have on them. So it based on that, took a step back and say we need to take a look at it at a wider view, and then do a proper job of consultation, because quite frankly I am very optimistic about the great minds that we have here in Alberta to be innovative, to at the same time improving supports for those with diabetes while managing our costs overall. And I know that if we take the time, get all the parties around the table, we'll be able to find those solutions and be able to achieve both goals.
Thanks, Michelle. Operator, can you put through the next caller?
Catherine Gregowski, Alberta Today.
Yeah, thanks for taking my question. I know that you had mentioned off the top that the continuous glucose monitors are now covered for pediatric patients with type 1 diabetes, but I know a lot of the newer technologies you're talking about, like, for example, the Tandem, in order for them to work properly or as intended, they need to be used with a continuous glucose monitor, and I'm wondering if that will be covered in other adult patients as well, or if it's what? Can you give some more details there?
Yeah. So these are one of the issue you just raised is one of the issues we'll be looking at this working group to delve into. Is sort of what what coverage we provide now. If we provide additional coverage, what is the impact going to be on the system and providing care, and actually cost savings to the system as well, and better outcomes in terms of health. So that's one of the issues that we'll be asking them to comment on, and then we'll be able to do some analysis. And as you know, we are continually evaluating this. We've had a number of making strips more available. The continuous glucose monitors for juveniles more available, and then this expert group will be able to provide input on other changes we need to make in the system, including provide additional supports.
Thanks, Catherine. Do you have a follow-up?
Yeah. So with this insulin pump therapy program, people with diabetes were kind of caught off guard by these changes. The same with people who are on biologic drugs. And so I'm wondering, are there other medication or other devices, the coverage that you're looking at changing at all as you go through and look for savings in the budget?
Yeah, so again, I just want to reiterate, this is not about savings. This is about better healthcare and building a sustainable system and looking at the healthcare outcomes and the costs in the entire system. So, this working group is going to be focused on supporting those with diabetes, and not only type 1, because that's what the insulin pump program was targeted at, very narrow type 1, but also type 2. And this is a significant issue, not only that Alberta is facing, but other jurisdictions across the entire country, and quite frankly, across the first world, in terms of chronic disease, diabetes, and driving other poor health outcomes and costs in our system. And the extent that we can intervene early and manage this chronic disease, we can provide better health outcomes for Albertans and manage the costs in the system.
Thanks very much. Seeing as there's no more reporters in the room and no one else on the line, that will conclude our program today. Thanks for coming out.
Thank you, everyone, for participating.